I know I personally struggle opening up about how I'm doing and my well-being when I go to the doctor. Generally, I'll go because I've got a sore back or a sore head or something like that. How do you encourage people to open up about what's going on within themselves, their well-being, about how life is tracking rather than physically?
Mm. So one of the things that's really is for those practices that have a hip, you can simply say to your GP, "Can I see your hip?" You don't need to talk about what you want to see the hip for. You don't need to go into any details, and then they basically will just walk you down the corridor to see the hip. You can put things on a piece of paper, pass it to the GP if you're not able to talk about things. I think the structure of our model is we're looking at the context that somebody's the context of their lives and how that problem fits into the context of their world. So it's very values based and very strengths focused. So yeah, we're looking at ways to move people forward rather than being in that stuck place.
And both, I guess, the whole service follows the Te Wharetapa Whā model, where each section of someone's life, whether it's their physical or mental, spiritual, social, is impacted by how they're feeling on that day. So pretty much kind of what Deb is saying is that you look at the person as a whole and figure out what it is that they need support with on that day at that moment.
And I think we often use diabetes as a really good example, because you might go to see the GP and the GP's focus is on getting that diabetes under control. Then you might go and see the hip and they'll have a look at what's the psychological barriers, what's getting in the way, what's your mind telling you about this illness. They might be saying, "Oh, don't worry about it, you'll be fine." And then of course the health coach is able to offer supports around movement and looking at diet and even being able to read labels on foods and things like that. And then looking at the context of it, you're looking at what's actually going on for this family. It might be that the adult isn't eating properly because they're focusing on making sure their children get fed, or there might be financial constraints. Then there's a whole lot of things that come into the context of somebody's life.
So how's this any different from counselling?
Okay, so it's a brief intervention primary care model, which means we're focusing on behavioural interventions. So it may be that you're struggling with your stress levels. So we're going to look at things that you've used in the past to manage your stress, and we're going to try and build more of those things into your life moving forward. Our sessions are 30 minutes long, so we really focus in on those values and looking at moving you forward. We're not looking at all the historical stuff. We're looking at what's causing you the most distress in the here and now, and how can we move you forward.
Okay, that's great.
So as I think I said before, very strengths based and very solution focused.
And how many hips are usually in a practice? Is there usually just one, or?
One full-time hip per about 10,000 population of a practice.
Right.
So some hips work part-time, 3 days a week, 4 days a week, just depending on the needs of the practice.
And would you always see your hip at the practice? It's not something that they would do home visits, or that you'd meet at the park, or it would always be in clinic?
Yes, the hips are based in practice, primarily so that we can have the warm handover when the patient wants to be seen. Sometimes they do run groups where they might meet in the park, walking groups and things like that.